I'm Robert McMullen. I'm a psychiatrist. I've been in practice over 30 years, and I specialize in difficult cases, particularly treatment-resistant depression, and that includes treatment-resistant depression in people that are bipolar. I went to Georgetown Medical School and then did my residency at Columbia Presbyterian. The thing I want to mention or want to talk about today is stimulants. The same stimulants that we use for attention deficit disorder. These, in a way, are perhaps the first antidepressants. In most people, if you're depressed and you took a stimulant, it might help your mood a little, and it might lift you up, but it wouldn't do the whole job. And then there's a little bit of a risk that certain people will overdo it and start abusing it, and or taking excessive amounts just to try to be able to get out of bed easier and function better. What the stimulants are used most often for in depression is when somebody's on antidepressants and they're not working 100%. Then, if you add a stimulant, you can often bring the person the rest of the way up, or a good deal better than they are. Ritalin is, or methylphenidate is perhaps the mildest, so that's the one would usually start with. And sometimes I have people take the immediate release and take a 5 milligram pill 1 or 2 times a day or 3 times a day, and gradually find out if it's going to work and then how much they need. And if they seem to need 20 milligrams a day or 30 milligrams a day, then subsequently we can give them a pill that's a slow release that is that amount. The other stimulant is an amphetamine, and basically there's 3 that are really closely related: dexedrine or dextromphetamine, adreol, which is also called amphetamine salts, and actually 3/4 of it is dexedrine, and Vyvanse, which is basically another form of dexedrine. These are a little more potent and sometimes a little more effective than methylphenidate. They are slightly more abusable, although the Vyvanse is made so that someone cannot take it IV. It won't work if people try to put it into a form that they can inject IV. And they're a little more likely to raise your blood pressure. Interestingly, Ritalin seems almost never to raise people's blood pressure, even those people that have hypertension. It does in a few cases. I have one recently that it does seem to raise their pressure. But the dexedrine adderall medicines often do, especially in somebody who has high blood pressure, so you have to watch that and be careful. Now, occasionally you will find people that have tried all sorts of antidepressants, and the only thing that works is the methylphenidate or the dexedrine. Donald Cline wrote a textbook, the first textbook on psychopharmacology, a few decades ago, and in it he describes some people who come in who have been on amphetamines for a long time. And sometimes they say, oh, I feel very guilty, I'm dependent on these. And my uncle, who was a physician, he used to get samples and he gave them to me and helped me get through college. But I've always needed them, and without them I can't concentrate, and I feel like I'm abusing them and dependent on them. And then you find out that the person is chronically depressed, and when they're not on them, they're chronically depressed. And when they're on them, they feel fine and they're functioning well. And how much do they take a day? 30 milligrams. Do you ever take extra? No. You ever get high? No. And then maybe they'll say, well, you know, once in a while, if I have to go to a dinner when I'm really tired in the evening or bored, I'll take a little extra chip to give me a little energy. And so these people are basically not abusing it, but are using it as an antidepressant. I've met a couple of people who were actually taking tiny doses of cocaine all day long to keep them out of depression. And that, of course, is pretty risky. And very few people could do that without ending up abusing them. So eventually, if your depression is not entirely gone, you should probably try adding a little bit of a stimulant.